Good evening, friends. Today I am going to discuss about an article which I discussed on AORA forum as well as TAS forum. This is about cost of sterility. Probe cover should not be mandated for single shot peripheral nerve blocks. This is a very interesting article. Usually, we believe that using probe covers is mandatory for single shot or when we are putting catheters. This is article by Philippe Garner and team, and this is really an interesting article. So in abstract, we see that available data seems to suggest that single shot peripheral nerve blocks have a low infection risk, and we will see in the detail it in the detail. And when we are using disposable probe covers in single shot block, it increases cost, it increases in environmental impact, and little evidence to suggest that they are effective at preventing infection if proper technique is used. So if you look at this article, if you look at the complication or risk of any nerve block, there may be risk of bleeding because of vascular puncture. There may be a risk of damage of surrounding structure, like surrounding other structures or neural structure, and there is a risk of infection. So and there is always fear of infection, and large variation in ultrasound hygiene practice exists that are driven by fear of infection. So we are, of course, worried about risk of infection, and we take different steps to prevent it. And historical preferences, it is rather historical preferences than robust scientific data. We are using various technique by historical references only. Most providers agree that the placement of indwelling catheter, nerve catheter necessitate probe covers. So when we are putting a catheter, we have to take all possible uh, aseptic precaution to prevent infection, because we are going to keep the catheter for a long time. But when we are giving a single shot block, there is a question mark whether to use all this precaution or not. There is a confusion regarding clean and sterile technique. So we will try to understand what is the clean technique and what is the sterile technique. So when we look at the cost, the various probes cover different type of probe covers are used, like sterile ultrasound probe covers and cable covers, and sometimes short covers or film dressings like Tegaderm. All those things are used to prevent infection, but cost of this is very quite high. That is $213 million per year. So it is a huge cost, and this is 2022 data. And we don't know what it affects on the carbon footprint or on environment. So we need to think about whether to use it or not. And available data should clearly support that the use of barriers lead to significant reduction in infection, or at least that the general academic consensus should be clearly in favor. But this is not the case. So what is clean technique and what is the sterile technique? The main issue is the current approach to the sterility, and the use of sterile ultrasound probe covers in regional anesthesia has to do to do with the distinction between clean and sterile techniques. So true sterile technique, what does it require? A sterile nerve block could reasonably only be obtained with a skin scrub and a surgical drape for the procedure site, sterile gloves and the gowns for all provider at a minimum, and a sterile equipment including sterile drawn up medication, syringes and flushes. There are far fewer advocates for such a setup. And when we are talking about sterile technique, actually it is half sterile technique. So it is not completely sterile. We miss some of all these things. So we don't follow all the things. There is no evidence that full sterile technique is superior to clean technique for single shot peripheral nerve block. And a sterile ultrasound probe core without a fully sterile setup is likely not beneficial. So if we don't take other precaution and we only use sterile probe cover, it is not going to help. So if we look at the difference between aseptic technique and clinical technique, this chart shows very nicely. When you are when we look at the utilization of barriers, when we are using aseptic technique, we require use of various barriers to prevent the transfer of microorganisms from healthcare personnel and the environment to the patient during a procedure. That includes sterile gloves, sterile gowns, sterile wraps, masks. When we talk about clean technique, it involves the reducing the number of microorganisms to minimize the risk of transmission from environment or healthcare personnel using the following, that is appropriate hand hygiene and clean gloves. So when we talk about clean technique, we require only proper hand hygiene and clean gloves. Patient and equipment preparation, like we need antiseptic skin preparation to the patient at the time of the procedure, sterile instruments, sterile equipment, and sterile device in aseptic technique. While in clean technique, efforts are made to prevent direct contamination of supplies and materials. So we try to avoid contamination. Environmental factor, like it includes environmental controls such as following: keeping doors closed during operative procedure, minimizing the traffic into the out of operating rooms, excluding unnecessary personnel during procedure. While in clean technique, patient environment undergoes routine cleaning. Contact guideline: only sterile to sterile contact is allowed. In sterile and non-sterile contact must be avoided, and here it is sterile to sterile rules not apply. So when we talking about aseptic techniques, it is not actually aseptic, it is half aseptic technique, or a clean technique. When suppose we are giving block, we give it in the block room, or in the pre-operative area. So it is not the sterile area, it is a clean area, of course, but not a sterile area. So throughout the anesthesia practice, many invasive procedures like taking IV line with ultrasound or any other technique, we use clean technique but not sterile technique. Same way in chronic pain practice like trigger point injection, we follow the clean technique, not the sterile technique. Indeed, Gaston Labat himself argued for a clean technique for peripheral nerve blocks. In his classic text, he stated, it's unnecessary to lay stress on the importance of asepsis, but on no account should the instrument be manipulated unnecessarily. The point and shaft of the needle should not be touched. This is very important. Shaft and the point of the needle should not come in contact with ultrasound or any unsterile part. So undoubtedly, puncturing the skin will always have an inherent risk of infection. Sterile needle, skin disinfection, excellent technique, and maintaining sterility of the needle and the insertion site are without question. So we need to follow this at least. We need to do skin disinfection. We require sterile needles, and we have to maintain sterility of the needle throughout the procedure. But proper technique is far more important than disposable equipment. So when we keep talking about probe covers, it is yes, it is important, but there are other things which are more important than this. So a procedure that is not fully sterile is simply the clean procedure. So when we are talking about when we are using covers, sterile covers, there is a false security. Partial sterility can lead to false security, and sometimes we touch here and there, and sterile protocols are not followed. Non-sterile single-shot block probe covers are used in some of the hospitals. They are short in the length, and that's why they are comfortable and people are using. But it is not desirable because you touch here and there, and you can spread infection more. Small surface area of a protective film like dressing or tegaderm, it is not useful because you will touch somewhere else, and you can of course give the infection. It is associated with gradual and another problem with when it gets stuck to it, and it will slowly damage the probe, and it will associate to the gradual destruction of the ultrasound probe protective membrane, and which can be a potential source of infections. So surely that the risk of infection would be reduced further if the ultrasound were never given a chance to contact the area outside prepared skin. There should every block be performed with full drape and gown? Should blocks only be performed in the operating rooms or designated block rooms instead of in congested preoperative holding area? This argument slowly snowballs. Therefore, the aim of every nerve block should reasonably be a clean technique rather than a completely aseptic technique. So the routine use of high-grade disinfectant and sterile ultrasound gel should be standardized. So we should standardize these things. For an infection to cause during a peripheral nerve block, it follows that infection material must enter the puncture site of the nerve block needle. So where we are doing puncture, if it is infected area, it will go through along with the needle. So if we disinfect that area with aseptic with the antiseptic solutions, then chances get reduced. Careful decontamination of an ultrasound probe should be certainly be sufficient. So we have to decontaminate a probe before and after every procedure. So once we start the procedure, we should clean it with antiseptic solution like sterilium, and at the end of the procedure, again clean the probe. A dirty or visibly soiled ultrasound probe should never contact with the skin that will be momentarily pierced by the needle, even if the risk of entering surface bacteria is exceedingly rare. Though it is rare, but we should be careful. To prevent transmission of the blood-borne pathogens, again we have to use disinfectant to kill the virus like HIV and HPV. So vigilance to maintaining the cleanliness of the procedure will mitigate risk of infection more effectively than the probe cover. So we should be vigilant and take care of all these things. Transducer for the interventional percutaneous procedures that are used for percutaneous needle for catheter placement, such as vascular access, thoracocentesis, paracentesis, arthrocentesis, pericarditis. So these are the procedure. Or when we want to put a central venous catheter, these are the procedure where we need to use completely sterile procedure, and where we should use probe covers. But again, this is the guideline where they said that it should be used with single use but non-sterile transducer cover. So guidelines are different. Here you can see lack of consistent guideline for national organization. So guidelines are different, and it is really difficult to understand what to follow. Spalding classification is often cited to guide hygiene medical equipment. So there are two relevant categories for ultrasound guided PNBs are like semi-critical and non-critical. Semi-critical is defined as the equipment that will come in contact with but does not penetrate non-intact skin or mucous membranes, while non-critical devices are defined as the equipment that does not contact puncture skin, I only contact the intact skin. So if we talk about ultrasound guided block, it is neither of this category mentions the use of sterile cover, which is reverse for the critical category. So if we look at the ultrasound guided block, it may be either semi-critical or non-critical, and they don't recommend using probe cover in such category, but in critical category only we should use it. So rational use of disinfection and sterilization is important rather than using the cover. If you look at the data, there is no prospective trial or case series or database studies that point toward that superiority in terms of infection sequelae or patient outcome. Even abstract and case reports of the infection sequelae are lacking. There is a single case report of Staphylococcus infection after peripheral nerve block, but here again ultrasound was not used. So it was because of not taking proper skins in disinfection proposal. Author did a study in their institute, and they found that using 70% isopropyl alcohol without the use of probe cover is more than enough. There are two largest studies where they studied 45,000 and roughly 7,000 patients, and then there was no evidence of single infection after single shot block. So there are some studies, but there is no robust data to suggest that we should use probe cover in all the procedures. So to conclude the thing, rather than dictating a shotgun approach to the infection control with a significant cost, approaching the patient within our care with a thoughtful evaluation of the infection risk of the planned procedure should be a viable option. So this article says that if you are taking proper precaution like clean the area where you want to block, clean the probe before and after the procedure, don't touch the needle or needle tip. And if you wear gloves, sterile gloves, that is more than enough rather than using the probe covers. Um, your needle entry should be always away from the probe. So when you put a probe, always enter the needle away from the probe. It should not touch the probe. It should be away from the probe. That will prevent the chances of infection. So in my opinion, this article makes sense. We can avoid using probe core, especially in the single short peripheral nerve blocks, if we take care of all other things. We don't require probe cores. And even if you are using probe cores and if you are touching here and there to set the USG machine or something else, or you touch here and there, you will increase the chance of infection. So this is all about it. I hope you like this commentary about this article. We'll try to make such commentary again and again. Thank you. Thank you very much.